Hi, my name's Tina. I'm a nurse practitioner here with EarWells, and I wanted to talk to you a little bit about the care of the baby while they have the EarWell system on. So babies that have the EarWell system can have baths on their bodies like normal, but your hair you just want to wash with a washcloth. You want to keep the EarWells as dry as possible. If anything does get in there, bath water, breast milk, bottle milk, spit up, we want to see the baby. But typically if it's just on the edges or on the outer portion, you can wipe it with some alcohol, clean the areas, and then it'll dry quickly. But if it actually gets inside, then we'll want to see the baby and let us know. Now, if they have the bath on their bodies like normal and their hair washed with a washcloth, if the hair still gets kind of oily, you can use a dry shampoo, spray it on their baby brush and brush it through that way, and that usually will get them through for the full 2 weeks. Now, when you come in for your 2-week visit, you can go ahead and give them a bath that day because we're going to be removing them and replacing them. So that's your chance to get a really good bath in, wash their hair. If they get wet, it's okay because we're taking them off anyways. Their pajamas, they can wear pajamas with zippers or buttons, or the onesies that open their shoulders are super helpful. That way you're pulling things down instead of up over the ears. If you do want to wear clothes that go up over the head, then just be careful when you're taking them on and off for that. You'll get a normal ear smell from the ears. If you've ever worn earrings and left them on, then you'll get that normal odor. Some people say it's a belly button smell. So if you smell that, that is a normal smell. But if you get a foul odor, then that will smell like stinky cheese, then that's a sign of an abrasion, and we'll want to see them for that. The EarWells should remain on. They should remain flush with the head. The white tape is the important part. So if the white tape starts to lift on the edges, we'll give you a roll of this brown tape. You can use that brown tape. We'll cut off about 1.5 inches. I'm just pulling it up. 1.5 inches, and then you can secure it onto the EarWells by lifting up. This is a splash guard. You can lift up the splash guard. You put the brown tape half on the white. Let's see if I can do it. Half on the skin, and then it can just stick like that, and it'll cover. It'll help secure it anywhere along the edges. If the white tape lifts so much that you can see all the way to the ear, that is too loose. That's when it rubs, and that's when we get abrasions. So that's when we want to see the babies. But if it's just along the edges, you can use this brown tape to secure it around. The other possibility is adhesive allergies, so they get allergic to the tape we use. Only happens about 3 or 4% of babies, but it does happen, so we want you to be aware of it. Again, if that happens, we'll take them off for a couple days, we'll let it heal, and then we'll continue treatment using a barrier method. Now, if you do need to remove the EarWells, there's a smell, there's a discharge, there's a problem, you can just take them off and we'll see them the next business day. So these are just tabs, they just pull off. Then you remove the inner portions of the retractors and the conchoid formers, and then we'll give you a little kit that has adhesive remover. This little adhesive remover you'll rub all over the white tape, let it sit for a minute or two, and then you'll slowly work it off like you would any other Band-Aid. And then we also have alcohol in the kit, so if there's any residue left, you can remove it that way. I think that's it. So if there's any questions, you are always welcome to call us, and we're happy to answer those questions. We're here Monday through Friday during business hours, and we'll call you back as soon as we can. If there's questions on the weekends, we do have nurses on call on the weekends, and we'll call you back during the days, but otherwise we'll see you during the week. Thank you.